Hello everyone, welcome back to our channel. As we grow older, managing our health becomes more important than ever, especially when it comes to the medications we rely on to stay well. While these medications can be life-saving and help us manage various conditions, they can also come with hidden risks, especially for our kidneys. Our kidneys work tirelessly as the body's natural filters, removing waste and toxins from the bloodstream. However, as we age, their efficiency naturally declines, making them more vulnerable to the chemicals in certain medications. With age often comes more health concerns, leading to an increase in the number of pills we take, and unfortunately, some of these can lead to kidney damage, a condition known as nephrotoxicity. Nephrotoxicity occurs when medications impair the kidney's ability to filter blood properly, which can have serious health consequences. Kidney damage from medications can vary from mild to severe, with the likelihood of harm increasing with age or if pre-existing kidney issues are present. There are two primary forms of drug-related kidney damage: dose-dependent, where the harm intensifies with higher doses, and idiosyncratic, which is unpredictable and can affect individuals differently. In some cases, avoiding these medications is the best way to prevent kidney damage. Drug-induced nephrotoxicity may result from conditions such as muscle breakdown, rhabdomyolysis, kidney tissue injury, or imbalances in blood acids and electrolytes, all of which can decrease kidney function. In this video from Healthy Care Over 50, we'll explore the impact of common medications on kidney health and provide helpful tips for managing these drugs safely, especially for those over the age of 50. Our channel is dedicated to helping you live your healthiest life by offering trusted, research-backed advice on aging, health management, and well-being. By understanding the potential risks, you can make informed choices to protect your kidneys while addressing other health concerns. Don't forget to subscribe to Healthy Care Over 50 for more valuable tips on taking control of your health as you age. 1. Lithium. Lithium is a prescription medication used to stabilize mood and treat certain mental illnesses like mania and bipolar disorder, which cause extreme mood swings. Some common brand names of lithium are Priadel, Canlit, Lisconum, and Liliquid. For over 60 years, lithium has helped many people manage bipolar disorder. While lithium is essential for controlling mood, it can negatively affect the kidneys. Long-term use can lead to serious kidney problems, including acute and chronic kidney disease and kidney cysts. Initially, kidney damage from lithium might be reversible, but it can become permanent over time. A major issue with lithium use is a type of diabetes linked to kidney damage called nephrogenic diabetes insipidus, which isn't related to high blood sugar. In this condition, the kidneys can't respond properly to a hormone that controls fluid balance, leading to excessive thirst and frequent urination. In rare cases, long-term lithium use can lead to end-stage renal disease, ESRD. Symptoms of kidney trouble from lithium include excessive urine output, constant thirst, frequent nighttime urination, and signs of dehydration like low blood pressure and a fast heartbeat. In severe cases, it can also affect mental status. Additionally, lithium can cause the kidneys to excrete too much sodium, leading to a condition called hyponatremia. If sodium levels drop suddenly, it can cause serious problems like muscle breakdown, severe confusion, seizures, coma, and even death. Patients should maintain a regular diet with enough salt and fluids while taking lithium. It's important to define a suitable dosage, get yearly blood tests to check creatinine levels, and seek medical help if anything seems wrong. Before starting lithium, let your doctor know if you have kidney, heart, thyroid, or breathing problems, Addison's disease, or Brugada syndrome. 2. Antiviral drugs. Most viruses clear up without antiviral drugs, but doctors prescribe them for serious or long-lasting diseases like COVID-19, Ebola, flu, genital herpes, hepatitis B and C, and HIV. These drugs can help clear the flu and fight other viruses. For flu, common antiviral drugs include oseltamivir, Tamiflu, and zanamivir, Relenza. For chronic infections like HIV, hepatitis, and herpes, antivirals can't completely cure them but can ease symptoms and reduce severity. While antiviral drugs are beneficial, they can harm the kidneys. This risk comes from direct toxicity or crystal buildup, which can cause kidney stones. Careful management and customized treatments are essential, especially for those with existing kidney problems. Take remdesivir, for example, a drug used in COVID-19 cases. Remdesivir contains SPECT, which the kidneys mainly remove. In people with kidney issues, SPECT might build up and cause kidney toxicity. Some clinical trials have inconsistently reported decreased kidney function with remdesivir. Data from global databases showed a significant increase in acute kidney failure cases associated with remdesivir compared to other COVID-19 drugs. However, more large-scale studies are needed to confirm its safety for people with kidney issues. Other antiviral drugs like adafovir, foscarnet, sofosbuvir, interferon, and tenofovir can directly cause cell death in kidney tubules by reducing blood flow or increasing toxins, leading to acute tubular necrosis, ATN. Adafovir and foscarnet can cause inflammation in the kidney's interstitial tissue, impairing function. Acyclovir and foscarnet can cause crystal buildup in the kidneys, blocking tubules. Some drugs like valganciclovir and foscarnet can manage kidney damage but also pose a risk of kidney failure. To use antiviral drugs safely, take them under close medical supervision. Never skip doses or take them inconsistently, as this can lead to antiviral resistance, making the drugs less effective. Remember, antiviral drugs are only available with a prescription, so don't buy them online or from unofficial sources. 3. ACE inhibitors. Angiotensin-converting enzyme, ACE, inhibitors are prescription medicines commonly used to lower blood pressure and manage heart, blood vessel, and kidney conditions. Common ACE inhibitors include lisinopril, Zestril, benazepril, Lotensin, ramipril, Altase, and enalapril, Vasitec. These drugs work by blocking an enzyme that produces angiotensin II, which narrows blood vessels and increases blood pressure. By blocking this enzyme, ACE inhibitors help relax blood vessels, lowering blood pressure and reducing stress on the heart. ACE inhibitors also improve blood flow to the kidneys, easing their workload and providing long-term protection. They can reduce the presence of protein in the urine, a common issue in chronic kidney conditions, making them a recommended treatment for people with kidney disease. While ACE inhibitors have protective benefits, they come with risks. Combining them with NSAIDs and diuretics can increase the risk of acute kidney injury, AKI. Additionally, not drinking enough water while taking ACE inhibitors can put you at more risk of AKI. If you're worried about your risk of AKI with these drugs, it's best to talk to your doctor about ways to lower it. Some people worry that ACE inhibitors might decrease their estimated glomerular filtration rate, eGFR, which typically indicates kidney function. However, ACE inhibitors lower eGFR by reducing pressure on the kidneys, allowing the small filters, glomeruli, to relax. While this may cause a slight decline in eGFR, it doesn't indicate kidney trouble, it means the kidneys are relaxing. However, sometimes eGFR may drop too much, especially in patients with heart failure, chronic kidney disease, or blockage in both renal arteries. If this happens, your doctor may adjust your dosage or temporarily stop the medicine to find the cause. In rare cases, particularly in patients with heart failure or severe dehydration, ACE inhibitors can cause acute renal failure. However, most patients recover without lasting kidney damage once they stop the medication, even if dialysis is needed initially. Patients with heart failure, diabetes, or chronic kidney disease benefit from ACE inhibitors because they reduce kidney strain and offer long-term protection. However, dosages should be carefully adjusted, and kidney function should be regularly checked. 4. Proton pump inhibitors, PPIs. Proton pump inhibitors, PPIs, are widely used medications available over the counter. They effectively treat conditions like gastroesophageal reflux disease, GERD, or acid reflux by reducing stomach acid production. PPIs target an enzyme in the stomach called hydrogen potassium ATPase, proton pump, which is crucial for acid secretion. While PPIs are generally safe and effective at soothing acid-related discomfort like heartburn, they carry risks, especially for kidney health. PPIs have been linked to acute interstitial nephritis, AIN, a kidney disorder characterized by inflammation in the spaces between the kidney tubules. Although only a small number of PPI users develop AIN, PPIs have become a common cause of drug-induced AIN in developed countries. AIN caused by PPIs often shows no clear signs and can go unnoticed. Long-term PPI use may lead to lower kidney function and sudden acute kidney injury, which can progress to chronic kidney disease, CKD. Another side effect of long-term PPI use is low magnesium levels in the blood, hypomagnesemia, which is linked to CKD. Hypomagnesemia can disrupt your electrolyte balance and cause inflammation, leading to kidney disease. It can also cause other serious health problems, including muscle spasms, seizures, and irregular heartbeats. A 2019 study in the Journal of Pharmacotherapy investigated the effects of PPIs on kidney function. The study examined how PPI use relates to new cases of acute kidney injury, AKI, and chronic kidney disease, CKD, in a large group of people. They found that among 93,735 people, those taking PPIs had a 4.35 times higher risk of AKI compared to non-users. Similarly, among 84,600 people, PPI users had a 1.2 times higher risk of CKD compared to non-users. Therefore, people taking PPIs should have regular checkups to monitor their kidney function and magnesium levels. While PPIs can provide significant relief from acid-related issues, long-term use can harm your kidneys and cause other problems like infections, fractures, or nutritional deficiencies. It's important to take PPIs for the shortest time possible to relieve acid-related issues without increasing the risk of side effects. 5. Diuretics. Diuretics help with conditions like fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common ones include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They work by increasing urine output and expelling excess salt and water, which can help lower high blood pressure, a major risk factor for kidney disease. Thus, diuretics are generally suitable for your kidneys. However, while diuretics are beneficial overall, they do come with risks, especially for kidney health. They don't directly damage the kidneys like NSAIDs, but they affect the urine's concentration and composition by increasing its volume and changing electrolyte levels. Excessive use or high doses of diuretics can lead to dehydration, which is a risk factor for kidney damage. A study examined 1,331 patients using diuretics who had acute kidney injury between 1999 and 2010 at a hospital. Initially, 96.2% of these patients already had at least one health issue before starting diuretics, with chronic kidney disease, CKD, being the most common at 55%. The study found that patients on diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the greater the risk. About 27.5% of the acute kidney injury cases were caused by diuretics alone, while others resulted from a combination of diuretics and other drugs. Always consult your doctor before starting new medications with diuretics. For people with CKD taking diuretics, it's important to stay hydrated and regularly check electrolytes and kidney function. Nowadays, home testing options are more available so you can check your kidney function from home. 6. Non-steroidal anti-inflammatory drugs, NSAIDs. Many people may not recognize non-steroidal anti-inflammatory drugs, NSAIDs, by name, but you've likely heard of ibuprofen, aspirin, Motrin, Colic, celecoxib, or naproxen. These are all NSAIDs, and some can be bought without a prescription. In fact, over 30 million people take an NSAID daily. They're commonly used to relieve headaches, sprains, colds, flu, and arthritis pain. NSAIDs work by blocking an enzyme called cyclooxygenase, COX, which helps produce substances that cause pain. However, COX also protects the kidneys during stress and helps regulate sodium and water excretion. By blocking COX, NSAIDs can harm your kidneys. All NSAIDs can cause acute kidney injury, AKI, especially in older people and when taken in high doses or for long periods. This injury happens in two main ways: changes in blood flow and inflammation, both due to blocking COX. First, blocking COX can narrow kidney blood vessels, reducing blood flow. This can lead to fluid retention, high blood pressure, and temporary kidney impairment. If unchecked, it might cause severe issues like acute tubular necrosis, where kidney tubules die due to lack of oxygen, leading to acute kidney failure. Although it might look like acute kidney failure at first, it can progress to chronic kidney disease, CKD. Second, although NSAIDs are anti-inflammatory, prolonged use can trigger inflammation in kidney tubules, which filter waste. This inflammation is rare, but kidney issues from NSAIDs are a major concern, affecting 1% to 5% of daily users worldwide. This means that each year, around 500,000 to 2.5 million people experience kidney injury from NSAIDs. Worse, NSAIDs are often involved in hospital admissions due to adverse drug events, some of which can be deadly. A 2006 study in the Journal of the American Society of Nephrology analyzed data from over 10,184 people prescribed NSAIDs. The study showed that NSAID use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use, highlighting the need for caution with these medications. In another study, scientists looked at 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients' kidney function decreased after NSAID use but returned to normal after switching to another pain reliever. Now, the next set of drugs on our list might surprise you because they're typically considered good for your kidneys. 7. Antibiotics. Antibiotics are commonly prescribed but come with risks, especially for your kidneys. If your doctor gives you antibiotics for a sore throat, skin infection, or other infections, it might harm your kidneys. First, let's understand what antibiotics are. Also called antibacterials or antimicrobials, these medications fight bacterial infections by either killing bacteria or stopping them from growing. Common antibiotics include brand names like ciprofloxacin, Augmentin, Flagyl, Bactrim, and amoxicillin. They're used to treat bacterial infections like strep throat, pneumonia, urinary tract infections, UTIs, and skin infections. However, antibiotics don't work against viral infections such as colds, flu, bronchitis, most coughs, and most sore throats. So it's crucial to be cautious when your doctor prescribes antibiotics. Improper use of antibiotics can cause side effects, including diarrhea and liver and kidney problems. Even when used correctly, some antibiotics like polymyxins, aminoglycosides, and vancomycin can still harm your kidneys. Your kidneys play a vital role in removing antibiotics and other drugs from your body, but antibiotics like polymyxins can damage kidney cell membranes, leading to injury. Similarly, aminoglycosides can build up in kidney cells, causing cell death and damaging kidney tubules. While the exact way each antibiotic causes kidney injury isn't fully understood, it often involves inflammation and harm to kidney cells. For antibiotics to be effective and safe for your kidneys, it's essential to use them correctly. Did you know nearly 1/3 of antibiotics prescribed in the U.S. aren't appropriate for the conditions being treated? This comes from the Centers for Disease Control and Prevention, CDC, in a study published in the Journal of the American Medical Association. Before asking for antibiotics, or if your doctor prescribes one, it's important to know which conditions they can treat. Ask your doctor, is this necessary? Most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage instructions carefully and stick to any food requirements. Even if you feel better, never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Important tips for safely managing medications. If you suspect that any medication is negatively affecting your kidney health, it's crucial to seek medical advice immediately. Kidney damage can develop without noticeable symptoms at first, but as the condition worsens, you might experience warning signs such as decreased urine output, swelling in the legs or ankles, shortness of breath, and extreme fatigue. Left untreated, these symptoms can progress to life-threatening stages. Staying aware of these early signs can help you take action before it's too late. If you're taking any medications that could potentially harm your kidneys, such as antibiotics, NSAIDs, diuretics, proton pump inhibitors, ACE inhibitors, antiviral drugs, or lithium, it's important to monitor your kidney health regularly. This includes checking your creatinine levels, glomerular filtration rate, GFR, and conducting urine tests for protein. These tests provide essential insights into how well your kidneys are functioning. Hydration is key when it comes to kidney health. Staying properly hydrated helps your kidneys filter out sodium, urea, and other toxins, minimizing the harmful effects of medications. Additionally, be mindful of potential interactions between medications that could place further strain on your kidneys. Always provide your healthcare provider with a full list of the medications you're taking before starting any new prescription to avoid potential complications. While medications are critical for treating various health conditions, some come with risks to kidney health. This is especially true for individuals with pre-existing kidney disease or those at a higher risk of kidney problems. Drugs like antibiotics, NSAIDs, and diuretics can impair kidney function through several mechanisms, including direct toxicity, altering blood flow, or causing dangerous electrolyte imbalances. It's vital for those with kidney conditions to avoid or carefully manage these medications. Work closely with your healthcare provider to adjust medication dosages if needed and to monitor your kidney function regularly. Additionally, adopting a healthy lifestyle can reduce your reliance on medications. A balanced diet rich in lean protein, fresh fruits, and vegetables, along with regular exercise, can greatly support kidney health and overall well-being. Taking proactive steps now can go a long way in protecting your kidneys for the long term. As we've covered, many common medications can pose risks to your kidney health, especially if not used correctly or for prolonged periods. However, by being proactive, staying informed, and working closely with your healthcare provider, you can minimize these risks and protect your kidneys. Your kidneys are essential to your overall well-being, and making small adjustments in how you manage your medications, diet, and hydration can make a big difference. We hope this video has provided valuable insights and tips that will help you make better decisions for your health. Don't forget to subscribe to our channel for more helpful content on health and wellness. We regularly upload videos with expert advice, tips on living a healthier life, and ways to better manage your health as you age.